Hey everybody, David Kemp here, host of Highway to Health podcast. I lead the healthcare vertical at MarketScale and really have enjoyed the conversations I've been privileged to have as a part of Highway to Health. I think you'll like this episode today. You know, in the past, we've talked a lot about how it will take a village to provide the best patient experience, to improve overall patient outcomes, and improve the overall health of our population. And today, we'll continue on that topic. I'm honored to have Eric Strafel, the CEO of Molecular Testing Labs, on the show today, where, we'll go over what it takes to prevent complex and advanced health issues so that we can catch issues earlier, provide access to diagnostics sooner and more directly to our community so that we can get the healthcare that we need, even when that patient population isn't in a centrally located place. So I'm honored to have Eric as a part of Highway to Health, and I look forward to learning from him and sharing that thought leadership with you. Eric, welcome to Highway to Health. Thanks for being here.
Yeah, thanks, David. Glad to be here and look forward to the conversation.
Absolutely. I really enjoy talking healthcare with, some of the thought leaders that I've been lucky enough to have on Highway to Health. But before we get started, I like to learn a little bit about you personally. I think it's always important to understand why you got into healthcare and how your background has helped you in the role that you're in today. Tell us a little bit about yourself personally and maybe your family, where you are located, and then we'll get started in business here in just a little bit.
Yeah, sounds good. So I was born in Cooperstown, New York, upstate New York, where the Baseball Hall of Fame is. So that has fed into, I'm a baseball fan, baseball card collector, and a lot of what we do today. I went to school for engineering, and when I got out, I wanted to go into either aerospace or biomedical. And all I knew is I wanted to make a difference and solve problems. And I was always attracted to a problem to solve. That led into, early in my career, a lot of work in aerospace and other industrial industries. Now I finally am back into healthcare, and so really excited for that. We have moved around, married, 3 kids, moved around the country. Now settled in Dallas, Fort Worth area. So pretty excited to be here. Our kids, 13, 10, and 7, are in school and sports. And so spend all our time in kids' activities and out and about in the community and in a lot of travel. We still enjoy traveling with the family and around the world.
Yeah, that's so cool. Are your kids into baseball too?
They are. They started out in baseball early on, and now they're into soccer, lacrosse, football, basketball. And so still kind of experimenting with all kinds of different sports and figuring out what they want to do. Either
way, you don't have many nights or weekends available. You're always at a field somewhere, I could imagine.
Yes, not at all. We get a month off in December, basically, and in July. And other than that, our weekends are booked.
I can relate to that. That's how I grew up, and our kids are the same way. We've got flag football practice tonight, so I'll be headed that way shortly after we record the podcast. So a lot of fun. Very cool. I love sports. I think it's a great way to build community. First of all, you get to, make some of your best friends when you're playing sports with somebody, but also it's a really healthy habit. Staying active is a great way to stay healthy. And I'd like to learn a little bit about, it sounds like you're a sports guy. What are their healthy habits, whether it's mental health or physical health, have you built? And, what kind of habits do you rely on to maintain that healthy lifestyle?
Yeah, I have always been a fan of mind, body, and spirit, and whatever that means to people. But, so I'm an avid reader. I love to learn and just kind of keep pushing myself and challenging. I do work out a lot. I can't really run anymore. I've got bad knees. So I just joined Row House. So I'm doing rowing machines for my cardio. And I have done martial arts for decades, and from Hapkido to Jiu-Jitsu, Muay Thai. And I really enjoy that because of the discipline of it. And as soon as you step foot on the mat, everything else kind of goes out the window, so it forces you to focus and be in the moment. And then, spirit is just connecting, being in the moment, especially with my family. I try to time box a little bit. So I'll get up in the morning. A good day for me, I get up in the morning, get a workout in, take the kids to school, get some family time, do a little bit of creative work where I find that in the morning for me, I am the most creative. So I'll get on a whiteboard and whiteboard a problem and see what I can come up with. And then the rest of the day, I kind of get to work, put my head down and get stuff done.
The morning times are special. Something about when the sun's coming up and you have some time by yourself, you're fresh after a good night's sleep. I really enjoy the morning time as well. I drive in about an hour to the office every morning, and those are the best. I think it's an unfair advantage for myself because I have a chance to get my thoughts in order to brainstorm on the day that's ahead. And so I'm with you. I relate with you in that way where the morning times are my creative times as well. So that's fantastic. What's a growing trend? I get to, I'm lucky enough to talk with people in similar roles as you. A growing trend is martial arts. How did you get involved? Is that something that you started early on in your lifestyle? Were you exposed to that as a kid, or what drew you to, Muay Thai and the other martial arts that you enjoyed being a part of?
Yeah, it was more, I was a wrestler growing up in popular in the Northeast. And as I got into my late 20s and 30s, I wanted a way to keep in shape, but also find some discipline. And it just kind of attracted me. So I started with Hapkido, a Korean martial art, and then got into, for a couple of years, got into jujitsu for a couple of years. And then the last 10 years have been doing Muay Thai. And it's a way to keep in shape. You meet new people. It's a bit of a community. And so everybody in those sports, you go to the gym and it's a community of people that is really special. And, and I walk out of there feeling like I'm fully refreshed and kind of hit the reset button, which I really like. And so it has worked out great for me and would promote that for anybody to try.
It's similar feedback that I've heard from others where there's a sense of community, a sense of accountability. Yeah. And then discipline. And, if you involve those parts of, martial arts into your professional world, there's a good chance that you'll be successful as well. We all need community, and we all need accountability, and we all need a sense of discipline to be successful in a lot of areas of our life. So I could see how those would relate. Very cool. Appreciate you sharing those things with us. You touched on your background, aerospace, biomedical. You had different areas of your professional career leading up to your current role at Molecular Testing Labs. I think that probably gives you an advantage. Tell us a little bit about how your journey and your career up to this point may have helped you, or maybe helping you currently with your outlook on healthcare and maybe your strategy or plan for the organization that you're with now.
Yeah. So the early on in my career, I was in engineering. As I got into leadership, I realized that just engaging with people to solve big, complex problems is really important. It's also really hard to do, which is actually where I started whiteboarding, was to kind of bring people together around a problem and start to break it down in ways that allow people to engage and bring their perspective. So it turned into a leadership style. And as I've gotten through my career, I've become more and more mission driven, where I want to do something to give back. And so I left Boeing, my last big company job. I left Boeing in January of 2001, also doing big things there, right, with what we can do around sending people to Mars in big, complex problems, highly regulated industry. So FAA instead of the FDA, right? And so know how to deal with that kind of stuff in big collaborative coalitions of organizations trying to make real change. So when I left Boeing, I launched a business accelerator focused on the mighty middle, or small, mid-sized companies. And it was a way to increase economic equity by creating access to tools and resources for small businesses, especially diverse businesses, to grow their business. And that mission led me to Molecular Testing Labs, where we also wanted to help purpose-driven companies grow their business and make a bigger impact. So early on in 2021, ran into Molecular Testing Labs. They have a really important mission to increase access and affordability of care in the diagnostics testing space, and had been working with them for a little over a year. And that mission and my passion for building businesses, and especially building businesses that are going to make an impact, just aligned. And it's a great team there. It's a great culture. It's at a point where I can leverage some of the value I can bring, which is building processes and systems and the organization to go achieve great things, find partnerships and collaboration, lead with transparency, all the things that I believe in and have written about. I can bring that to Molecular in a really important cause, which is an industry that accounts for 11% of jobs in the US, 20% of the budget, right? And is one of the most significant things that we have on, our agenda for the next couple decades.
No doubt about it. And, if you think of two trending topics right now, I think you've covered them both, aerospace, where you've got Elon Musk going to, doing the awesome things that he's doing as a part of SpaceX, and not just Elon, but, other companies in this trend there where we're looking at interplanetary travel. And that's some really exciting things. It's pretty cool that you have that in your background. And then healthcare. I mean, everybody is a patient. Everybody will ultimately be a patient of some kind. And you're right. We get to make an incredible impact when working in the healthcare industry, because we know every time we come into work every day, we're hopefully doing something that improves patient outcomes, care coordination, the overall health of the population. And so it gives you some real drive, real purpose in your daily routine in solving those complex problems. And healthcare has no shortage of those complex problems. And so I think, with you working through some of the complex issues that you've had in other industries, bringing a fresh perspective to molecular testing labs in the healthcare industry in general, you guys could see some great success. Tell us a little bit about going more directly to the patients and providing a service and services to maybe some underserved areas, and tell us the traditional challenges that people that may live in rural areas have experienced when accessing diagnostic services and testing opportunities. What were those challenges, and why were we experiencing those challenges in the past, and how are we improving that process today?
Yeah. So there's a couple elements of that. One is access in hard to reach communities geographically and or with, when you look at the social determinants to health, it's the environment, physical, social, and access to care that people have in their community, which varies widely, right? And so I've been fortunate to have our kids have gone through a lot of things that we've had to deal with in the healthcare system. Our first son was born in Mississippi with clubfoot. We had an amazing doctor there that helped us with that journey, and he's now 13 and plays sports, and you would never know. But we had access to care, and it made a difference. It changed the course of his life. And accessing good care is really important. And so with what we do at molecular testing labs, with home-based test collect in programs, partnerships with public health, we can try to get testing to communities that have a hard time getting testing, sometimes covered by other funding mechanisms. So people can test for chronic conditions, therefore get in front of it so it doesn't become, so they can get into preventative health instead of trying to deal with an issue when it's already too late. And then we can get in to test for infectious disease, stop the spread early, in all kinds of good things that, reduce the stigma for testing for people that are testing for STIs, and just making sure that their sexual health and wellness are all good as well. And so there are a lot of different things that home-based test collection allows you to find solutions to, with getting into different communities, reducing the stigmas around testing, and then informing hopefully more predictive solutions and better outcomes in the long run by allowing everybody to get access to diagnostic tests.
Yeah, I love that. If we can get closer to the source by going more directly to the patient, we have an opportunity to catch things sooner and at a less advanced or less complex stage. You mentioned something that I think is interesting, and that's around stigma, where even though we know something could have a dramatic impact on our health and our family, there's a stigma out there that might prevent us from going and getting, the test that we need, the diagnostic that we need. When I think of the most disruptive businesses right now, and really any industry, it's the ones that are meeting the customer, meeting the consumer where they are. And typically that's at home. Healthcare is seeing a huge shift to providing services at home and in home. Tell us about how molecular testing labs is disrupting the traditional healthcare space by allowing and empowering patients to do more themselves and in a setting that they're more comfortable with.
Yeah, I think what a lot of people could relate to is I don't like going to the doctor's office because I don't want to know what's wrong with me, because that, then I have to deal with it. Right. And so there's that. There's also topics that are hard to talk about, there's a stigma around. If you go into a clinic for sexual health, what does that say about me? And it leads to the perception that we're being judged, which none of us like. And then there's a lack of transparency, where a lot of times you go to the doctor's office where the people that have a primary care physician, many don't, but the people that do have one, you go in, then they order the tests. You need to come back later, figure out what the results of that are, and then, address it as needed. All that takes time and money and time away from home. And so you might need a babysitter. If it's a single parent, it's just hard to do. And so by meeting people where they are, by providing testing in advance to inform better outcomes, by providing connection to care through telehealth and telemedicine, we can give a patient better visibility to some opportunities they may have to improve their health, connection to somebody to talk through what some treatment methodologies might be for that, and do all that at home, where they don't have to find a babysitter, leave work, go out and fear being judged by the public for wherever they're going. And just make it as easy as possible. And our goal is to reduce as many barriers as we possibly can to allow people to take ownership of their health and find real solutions without the judging or, the other constraints that some people have.
Yeah, the barriers are plentiful, especially for the average person. They even start to add up more when you think about those in underserved areas or rural areas. One of them's cost. How does molecular testing labs and going directly to the patient, providing this virtual opportunity of engagement, how does that help? How does it help the patient financially? And is there any benefit for the provider or the insurance company financially?
Yeah, I think as of last number I saw, 2018, still 28 million people in the U.S. not covered by insurance. And so whether you're covered by insurance or not, many insurance plans these days have some sort of preventative care. But if you're covered or not, catching things early before it's going to cost a lot of money to treat that does save us time and money down the road. And if you let something move on too long, untreated chronic illness, diabetes, kidney disease, those become very costly for medical plans. And if you look at medical plans overall, the big expenses are by a smaller percentage of the population dealing with chronic conditions, and with the aging of America. That has been talked about a lot, and where that's going over the next couple of decades, we're going to have more than half the population dealing with multiple chronic conditions. And so the ability to get into more preventative care and proactive management of those chronic conditions can really lower costs over time. And so where it seems like it might cost more to get testing now when something may not be wrong, over time, that's generally going to save people and payers money and health plans money, so they don't have to adjust rates down the road to account for that.
It's like oil changes in your car.
Yeah, great example. Yep, perfect analogy. Yep.
If you ignore the red light for too long, you're going to have bigger problems on your hands.
Yeah.
So, I love the idea of driving awareness, driving opportunity, driving access earlier on in the process, and that's a great service. That's a great opportunity for patients to know more about their health and then be able to make decisions earlier to benefit their health. There must have been some pretty drastic innovations in this service over the last few years to provide an in-home, test or diagnostic.
Yeah, I mean, we have better tools and processes than we have ever had. We have great doctors and hospitals that are developing new ways to diagnose and treat health conditions every day. And we're as good as we've ever been. And yet access to care has not evolved much. And so the small piece of change that we can play an impact in is access to care with self-collect testing. But those innovations, it's part of a big system that needs to change over time. And so my belief and what we are trying to do at Molecular Testing Labs is just play our small role find coalitions where we can help create visibility and coalitions around access and affordability to care, find different types of partnerships with other people that share our mission. And I do think it's many small and mid-sized companies that are innovating over time that are going to change the system. There's not one big bang that's going to change healthcare. And so we want to play a role. We want to constantly be pushing the ball forward. And the innovation isn't just with the science and the technology. It's also with business models and services to deliver care. And the best example was what we had mentioned before around telemedicine and telehealth, where that shift in a business model that creates access to care for people that don't have to go into a brick and mortar setting, I think is huge. And I think we're going to see more and more of that.
Yeah, COVID was a compelling event there for sure. Yeah. Which lends to the need for a flexible solution. Because you never know how things are going to change over time, and to stay relevant, you probably need your solution, your service to be flexible. You test for a lot of different things. You mentioned in-person or telehealth. Tell us how molecular testing labs has implemented flexibility in the services that you provide because of the unknown that's out there in healthcare and in our current environment.
Yeah, I think our version of flexibility is meeting patients where they are in terms of access to testing. And so where we can work with partners to get self-collect tests out into communities that are hard to reach, where we can make our tests available online through portals and partnerships with telehealth practices in other clinics, we can make testing hopefully more accessible for people to meet them where they are. Our partnerships with departments of health, both especially at the state level, I think are key, where we can work with population health organizations that are trying to make a real difference for the specific needs of communities, where we can give them a solution, where we partner with them. We can go in and provide access, help collect information that better helps us diagnose and especially stop the spread of disease. Monkeypox, great example. We will play our role in what we can do to make tests available so we can contain the spread. So that our version of flexibility is getting tests out to people that test for all sorts of health and wellness panels and in STIs and infectious disease to inform better outcomes.
Yeah, that was one of the challenges during COVID, right? Having enough tests, having access to tests. With monkeypox, I'm sure we're implementing some things that we learned during the COVID pandemic. And then there will be others, right? And we'll continue to evolve and grow and improve that process. Can a patient order directly the tests that you guys have, or does it have to come from a physician or a referral or a prescription of some kind?
Yeah, so all our tests have a connection to care, so people can, depending on the result, they have access to somebody to consult. We primarily work through channel partners, and so Everlywell, Nurx, MyLabBox. So channel partners where we are offering our tests to support programs, and then they can buy through their portals, their digital websites, retail channels on the shelf. A lot of those tests that you might see online if you search on Amazon, a lot of those tests will come to our lab. And then we run the test, provide the information either back through a portal or through a partner network.
Gotcha. So I see a lot of different communities there that you're having to engage and educate. How important is it to educate, these partners of yours, these channel partners and distributors on, some of the innovations and flexibilities that you guys have implemented?
Yeah, I think the real education is with policymakers and regulatory shaping, where the payment methodologies aren't necessarily keeping track with the innovations. So as we're looking at how do we code for payments, are we paying the right amount for coverage? As we look at CPT codes and how we're coding for reimbursement, and then as we look at more preventative procedures, like PrEP is a great example, now covered. Preventative procedure that we can get out and make a real difference in communities to help people manage their care. And the regulatory environment is, it's a big thing to change, right? So keeping up with innovation and new types of testing, getting that to market, making sure that the claims process and reimbursement strategies are aligned is really important. In the case where that is, there might be a policy or regulatory position that allows for reimbursement, then the health plans have to follow that. And
Right.
so bridging that gap and educating where there is a gap and trying to help us close that gap is really important. If that doesn't happen, we essentially develop our own task force and to try to help make sure that we're getting tests out there and then getting reimbursed. And we even we'll lean forward and for mission-driven tests. Sometimes we'll do it for cost just to get out there.
I had somebody recently tell me, no margin, no mission. And that's the regulatory part that you're talking about, which it may be a better mousetrap. It may be better for the patient, maybe better for the provider. But if it's not financially responsible or beneficial, it's hard to implement. And so you're right. I didn't even think about the regulatory or compliance piece, the fee schedule piece. One thing during the COVID pandemic that did help was where they opened up, increased payment and fee schedules for telehealth for these providers, so that they could actually get reimbursed and paid at the rate that they needed to be for patients that were leveraging that telehealth and virtual health setting.
Yeah.
So as innovation continues to grow in other segments of the healthcare provider, space, I think the fee schedules and the reimbursement models will continue to evolve too, and education will play a big part in that. I have no doubt.
Yeah, and I do think the next horizon for us is data. And so we all talk about the disconnectedness of electronic medical records and healthcare provider networks where your record doesn't track with you, right? And so it really makes it a challenge to manage the life cycle of care for a patient. The role that we can play is to provide population health data that can better inform care. How do we deliver better outcomes to a specific population by providing data that shapes policy? And so, of course, HIPAA compliance around data can be a challenge, but it's also a really important thing that we need to work within. And so as we get better population health data, especially for underserved communities, hopefully we can start to, work with partners and shape policy and help drive innovation there as well. Yeah.
And education will play a big part in that throughout. You guys have some great thought leaders, some great partners to help with that. If you, while we have this opportunity, if you had one thing that you wanted the listeners of Highway to Health to walk away with, maybe it's something you've mentioned already, maybe it's not something we've touched on. What would be that one thing that you really wanted to make sure they walked away understanding?
Yeah, I think it's going to take all of us in a lot of small steps moving in a common direction. And so where we need to get out there with thought leadership and talk about the opportunities, more time on opportunities than challenges and real solutions, recognizing that it's many small steps. We do have some great thought leaders in our company with Dr. Hall and Dr. Saley. As we get out there with new types of tests, a great example is Hep C viral load. We have a partnership with the Oregon Health and Sciences University. And as we get into a population, show that access to that test has better uptake, high positive result in terms of understanding what we can do to better treat Hep C, which is a prevalent condition in many communities. That's a great example of us trying to bring an innovation into a market with a public partnership to create access to communities and hopefully deliver better outcomes. And we need to do that 1,000 more times. So creating a working environment where we talk openly about all those environments, from policymakers and regulators all the way down to labs and hospital practices, care and payers, creating that open environment where we can together work on solving these issues, I think is really important. And so I am optimistic. So my one takeaway, be optimistic, small steps, do your part, right? And find partners to go with you.
it's going to take a village. It's going to take the provider, the patient. We all have our own responsibility. The payer, the government, and if we can all come together, we can make some substantial improvements, some substantial growth in the delivery of this type of care. And but it's a lot of people to get on the same page. It's a lot of people to educate, and it's a big challenge, especially when things are changing so quickly. And so you're exactly right. We all have a part to play. But be optimistic because the technology is there, the innovation is there, the knowledge is there, and molecular testing labs is proof of that. Your leadership is a proof of that. So I think being optimistic is good advice, because we're seeing, if you look at the last 10 years, we talk about being on an open road journey to improvement in the healthcare industry. Look at the last 10 years compared to where we are now. We've made substantial growth, and for good reason. 10 years from now, who knows what opportunities are ahead of us, and the improvement and innovation that's just down the road that we'll see ourselves arriving at here before we even know it.
Yeah, I mean, we're making progress. It's the long haul. It's going to be persistence that wins. When you look left and right at the people beside you on both sides of the aisle, people want to do the right thing, right? So my optimism also comes from, I know there's a lot of heated conversation about which way to go, but in general, people want to do the right thing, give the benefit of the doubt, inform, right? You don't need to take a position on everything. Inform people of your perspective, give people time to digest, and we'll slowly move forward. And even with all the different backgrounds and perspectives that we bring.
Yeah, no doubt about it. Well, I can't thank you enough for your time today. It's great to get to know you. Welcome to Dallas. Welcome to Molecular Testing Labs. Can't wait to follow you and learn more about all the innovations that you guys have coming ahead. So thanks again for your time.
Thanks, David. Appreciate it.
Have a great one.